Opioids. Opioids are analgesics used to manage moderate to severe pain. Some examples include morphine, hydromorphone or Dilaudid, fentanyl, and oxycodone. The major adverse effect of opioids is respiratory depression. Opioids suppress respiratory and cough center located in the medulla of the brainstem, causing reduced respiratory rate, usually less than 8 to 10 breaths per minute. As a result, it can lead to hypoventilation and severe hypoxemia. Level of consciousness should be monitored closely because oversedation can quickly escalate to respiratory depression. Naloxone is an opioid antagonist used to reverse respiratory depression. Please see my separate video on opioid-induced respiratory depression. Other side effects of opioids include hypotension and bradycardia due to the release of histamine. Educate patients to change positions slowly and call for assistance before getting up to avoid falls. Nausea and vomiting is another common side effect. It can be treated with antiemetics and it usually resolves over time. However, if patient experiences bilious vomiting, providers should be notified because this is indicative of a bowel obstruction. Constipation is an expected side effect. Opioids bind to opioid receptors in the intestine, which slow peristalsis and increase water absorption, leading to constipation. Unlike nausea and vomiting that resolves over time, patients will not develop tolerance to this side effect, so proactive measures to prevent constipation should be implemented. For example, encourage ambulation, hydration, intake of fiber, and regular use of laxatives while on opioids. Urinary retention can also happen. Opioids cause a decrease in the sensation of bladder distension, so patients do not have the urge to void. Nursing interventions. Monitor vital signs, sedation level, and respiratory rate. Encourage activities such as turning, deep breathing, and use of incentive spirometer to help prevent atelectasis and pneumonia. Initiate fall and safety precautions due to potential hypotension and dizziness. Assess the level of consciousness before administration of opioids. Assess the effectiveness of opioids 30 to 60 minutes after administration and pre-medicate before painful activities. If given intravenously, dilute it with normal saline and give slowly over 2 to 5 minutes because rapid administration can cause severe hypotension and respiratory or cardiac arrest. Assess for bowel sounds and encourage measures to prevent constipation.